The deaths of 21 people at a Texas elementary school are just one of the recent tragedies, highlighting the need to improve mental health in all communities. Locally, mental health experts just completed a study called the Community Health Needs Assessment, which identifies the key health needs and issues here in North Florida. Tarek is joining us now to tell us what was found and what's being done about it. Tarek.
Well, access to health care, poverty, and chronic diseases like cancer and diabetes are the main factors locally that lead to mental health deterioration in North Florida. Now, the Health Planning Council of Northeast Florida collected data from a 5-county area and developed an action plan. Mental health care issues in North Florida continue to disproportionately impact certain demographic groups, including seniors, veterans, members of the LGBTQ community, and minorities. The COVID-19 pandemic only exacerbating North Florida's plaguing problem of providing mental health resources to the people who need it the most.
The problem is bigger than the health system can handle on its own. This is a societal issue. When it comes to the well-being, the health and well-being of someone's mental and behavioral health, it's not simple a pill that someone can take.
Anne Marie Knight, who's the Vice President of Community Engagement and Diversity at UF Health, says the CHNA is an opportunity for communities to pause and see what's working and what is not. She says access to mental health care is North Florida's #1 issue.
And access could be a plethora of things. It could be access to primary care, specialty care, but it's also access to, good housing or fair, financially decent housing and fresh fruits and vegetables, transportation.
CHNA reveals that it's not just local health systems that need to address mental health. She says there's a desperate need to find ways to empower other organizations to recognize and respond. One of the action plans is to create what's called Blue Zones, which helps to create healthy environments.
Do we have safe spaces for exercise and engaging in the community? Or is health access equitable? Why with one group, as you've alluded to, may have higher prevalence of a particular disease? What can we do differently for that particular population?
A deep dive into the data reveals that life expectancy rates in every Northeast Florida county except for St. John's are lower than the state average. And out of the 5-county area, when it comes to the health of the population, Baker and Duval County rank among the lowest in the state. Knight says it's key for other local organizations and businesses to review the data and put action plans into place.
Just pick any industry, it doesn't matter what it is, right? I'm not saying that you have to partner with a hospital to execute a plan, but maybe you look at your plans. Make sure that there are resources internally for your staff when they're dealing with the day-to-day stressors.
North Florida's 5 health systems and 13 hospital campuses are all in partnership in using this data from the assessment to try to meet the needs of our community. Mary?